Amy Alderman. I'm a plastic surgeon in Atlanta, Georgia.
And I'm Ida Joyner, an anesthesiologist in Atlanta, Georgia.
And we're the dream team.
Was I supposed to chime in for that? Sorry.
I'm Amy Alderman. I'm a plastic surgeon in Atlanta, Georgia.
And I'm Ida Joyner, an anesthesiologist in Atlanta, Georgia.
We're North Atlanta Plastic Surgery,
also known as the Dream Team.
Finally decided that I was probably old enough not to be an employee and ready to be on my
Out
own.
on your own, like a big girl.
And put on my big girl panties and just do this. And asked my best friend and partner in crime here to see if she wanted to join me.
Well, actually, if you think about it, you told me one day that you wanted to go on and leave the practice where you were and do your own thing. And I told you that honestly the only reason I was currently working was because I enjoyed us working together and I enjoyed taking care of patients together. So if you were going to leave, I really had no reason to stay. So at that point I think we decided, well, you know, we can do this together.
We have a very unique model in that
Yeah.
we offer something very different to patients. It's rare that you have a surgeon and an anesthesiologist team up and do every case together.
Yeah.
And my patients really enjoy that team approach that we have, and I wasn't going to have that if I joined another group, and I didn't want to lose that.
Mm-hmm.
My patients enjoy it, and I think that we provide better care. The fact that we always work together and have the same philosophy on patient care and how
Mm-hmm.
patients should be treated.
I do the same thing when I go in and talk to the patients too, because I think that they're not accustomed to that. They go to practices where there's 2, 3, 4 plastic surgeons all in business together, and at the end of the day, if you think about it, they're competing against one another, but they're certainly not taking care of patients together. They each have their own set of patients, and they don't care for patients together. So I think what makes us different is that you, as a plastic surgeon, me as an anesthesiologist, we actually are working together and we have one focus, and that's the patient.
Yeah,
and I think they love that because they're either concerned about their outcome, or they're concerned about the anesthetic outcome, whether it's surgical or anesthetic. And they get the opportunity to see us both work as a team and know that we're focused on one thing, and that one thing is them. When we were starting this and we had this idea of doing this, I remember you giving me a hard time because I read a business book and I came up with all sorts of ideas, but the first idea, of course, is coming up with your purpose, your vision.
The only reason why I'm laughing is because Dr. Joyner is truly one of the smartest people I've ever met, and so when you assign her a task, she goes full out. So she read every business book out there in the course of 30 days. So
I don't see anything wrong with that. that's
so
not
yes,
a bad quality
we
in
do
a partner.
have a mission statement.
There you go.
Yes, I remember the name.
Very good.
For North Atlanta Plastic Surgery, we have a mission statement.
So what is
it?
Our mission statement is
To take great care of patients.
Yes, absolutely. But to give them an opportunity to come in and feel like they are comfortable and secure enough in the environment we've created and with the people, you, me, and everybody else that's surrounding us, right, all our staff, to share what they are concerned about when it comes to their body. Tell us, I mean, you go in and see these new consults, and I mean, what kind of experience is that for them?
Well, I try to put myself in the patient's perspective, which isn't hard to do because most of my patients are pretty much like me in the same stage of life. And so I do try to create the most comfortable, relaxing environment that I can create, because it's really hard to come in as a patient and meet a stranger and to be vulnerable to that person and share your insecurities and discuss what you're concerned about.
Much less take off your clothes.
Right. So, the nice thing is I think we have done a really good job of picking staff that reflect our values,
Absolutely.
that are very caring to our patients, try their hardest to make everybody feel as comfortable as possible. And I love the fact that I have you in clinic, and so if I have a patient that's concerned about the anesthetic part of the procedure, I can get you right away and you can talk to them on that initial visit and kind of address their concerns. So I think we have created a really nice team approach, and we have a great group of women that are helping us, supporting us take care of these patients. We want each patient to feel like they're the most special, important person there that day. This is not a puppy mill. We're not trying to see as many patients as we can in a day.
Absolutely.
We want to create
Yeah.
a very special boutique type experience for each patient, so they feel like they're the most important person, and that we can customize that surgical approach or non-surgical approach, because we've got this amazing med spa, and address their concerns surgically or non-surgically.
Right. And I gotta tell you, one of my favorite things I've noticed already, and I'm sure you've got your favorite things since we've started this 8 weeks ago, but one of my favorite things is when you call me into the room talking to those patients, because it's a lot of fun for me to go in and I know her. She's extremely humble, and she will absolutely let the patient know that you're completely confident in the procedure that they're talking to you about. But I get to go in and I get to go, did you know that she actually was asked to do live surgery in breast augmentation in Atlanta at the biggest, most prestigious meeting they have for breast? She won't say that to the patient, but I will. And do they hear about what her outcomes look like for an augmentation lift or even a breast reduction? I mean, beautiful. So you're going to be confident, and you're going to tell the patient, hey, I'm in my comfort zone. I love this. I'm going to knock this out of the park. But I get to go in and I get to show a whole different perspective.
I didn't know you were doing that. I asked you to go in to talk about anesthesia.
I talk about anesthesia.
I do. Here.
I talk about anesthesia, but I also want to make sure that the patient realizes that they've come to a surgeon that is, extremely recognized, nationally recognized for these procedures.
The one thing I want to share about Dr. Joyner is that she is my best critic and also my hardest critic. So she sat here and said very nice things about me, but I will tell you, she is
Tough.
Really tough on me in surgery. She's the only anesthesiologist I've ever worked with that during the case, especially like a breast case, I sit the patient up and I'm looking at how the breasts look while gravity's taking effect. She walks around from where she's supposed to be to the end of the bed and is looking.
Don't worry, I can still take care of you even when I walk around.
Looking at what I've done so far with me, and she'll tell me, amazing result, stop, you look great, or she'll look at me and go, I think you should keep going, So it's nice to have this team approach where she's my best friend, but she's quick to tell me when it looks amazing, and she's very quick to tell me we need to keep working. So this has been a huge leap for us, an amazing undertaking, exciting, lots of work. I'm surprised you haven't killed me yet, because you could be retired by now and you've never worked so hard.
I know, I feel like we're in residency together again.
But the amount of support that we've had from our previous patients, our current patients, and especially the women in business in Atlanta that have come behind us and supported us.
Everybody, our patients, our reps,
amazing.
Our friends.
So we just want to thank everybody for their support.
Absolutely.
And also let you know how excited we are to be North Atlanta Plastic Surgery.
And even more excited, or equally excited, to be the spa at North Atlanta Plastic Surgery, which we're calling the spa at NAPS, just because it sounds fun. Both the practice and the spa, I think our patients are going to enjoy being part of both with us.
And I think the most exciting thing is, when I talk to previous patients there and I explain to them what I've done and who I'm with, they always go, "Oh, that's the anesthesiologist I had. Y'all went in together." And a lot of folks kind of nickname us the Dream Team.
Yeah.
And so
That's our new nickname.
it's
the
really
Dream
exciting
Team.
to think their dream team continues.